Okay, good morning. How are you all doing this morning? All right, let's talk about sex. So I am Dr. Terrie Thomas, and I was born and raised here in Baton Rouge, as Deborah said. And another fun fact about me is that I finished my residency at LSU in New Orleans in 2006. So if you do the math, my chief year, my final year of training was in 2005. And a little storm named Katrina blew into New Orleans and blew everybody this direction. So I finished my final year of training actually between Baton Rouge and Lafayette because there was no New Orleans. Hey Lisa, how are you? So, and I've had the privilege of being in private practice with Associates in Women's Health ever since I moved back home. So I've been there almost 12 years this August, and I can't believe I get paid to do this. I wear pajamas every day, I deliver sweet little babies, and then I take care of women all day. So it's just been an absolute pleasure, and I thank the women in this community for letting me serve you. So come on in. We have room. Okay, so typically when we talk about menopause, everything's doom and gloom, the change. But I'm a glass half full girl, and so I'm an optimist. And when I found this quote, I thought it was something very inspirational to share with you all. So many women I've talked to see menopause as an ending, but I've discovered that this is your moment to reinvent yourself after years of focusing on the needs of everyone else. Can anybody tell me who they think might have said this very inspirational thing? She's the queen of inspiration. Oprah, okay? And then if all else fails and you're having a really bad day and you're having so many hot flashes and you're like, Oprah doesn't know what she's talking about, this is bad, then just laugh. Life is very tough, and if you can make a joke to make something easier and funny, do it, okay? And we have the late Joan Rivers to thank for that, okay? So who remembers the Incredible Hulk? When I was a kid, I grew up with the Incredible Hulk, and I waited for that moment when David Banner would turn to the camera and he'd say, "Don't make me angry. You wouldn't like it when I'm angry." I use that line on my kids sometimes in a really low, deep voice, and it works wonders. So that's one of my favorite quotes, and so I thought it would be very appropriate for today's talk. So Female Anatomy 101, there is, if everybody could take out their pen and papers, there's going to be a quiz and a graded test at the end. No, I'm just kidding. So what do we as girls look like on the inside? Let's see, so the little point, I'll just point with my fingers. So we actually have a central uterus, okay? And the uterus is actually where our periods come from, okay? And then that's also where we carry our babies, okay? The opening to the uterus is the cervix, okay? And so when you're in the midst of having babies and you go to the obstetrician and they say you're 1, 2, 5 centimeters dilated, that's your cervix, okay? The cervix is also where we get our pap smears, okay? And then the uterus has two arms are fallopian tubes, okay? The fallopian tubes are actually where we conceive, okay? So every once a month, usually a couple of weeks before your period, you ovulate or you release an egg from either your right or your left ovary, and then whenever you have intercourse, the sperm unites with the egg and forms a little ball of cells, an embryo, that's the precursor to the baby, okay? And then, of course, it gets pushed down into the uterus where then it can grow into a full-term infant, okay? At the ends of the fallopian tubes sit the ovaries, okay? And so we're gonna spend a lot of time today talking about the ovaries. And then, of course, we have the vagina where all the fun stuff happens. So why do we as women go through menopause? So I thought that the best way to talk about this is to start from the very beginning. When we are born as little baby girls from our mama's tummies, we are born with about 1 to 2 million eggs, okay, at birth. And then by the time you go to puberty, that number is about 300,000 to 500,000. And then if you fast forward all the way to menopause, that number is about 1,000, okay? So if you do the math, the average age for puberty is somewhere between, believe it or not, in these days, 8, 11, 12. And then if you fast forward to menopause, the average age for menopause is 51 here in the United States, okay? 1 to 2 million down to 1,000, that's not mathematically correct. So most of these eggs actually die through a process called atresia, or programmed cell death. And unfortunately, as we mature, so when you're 25, your eggs are 25 years old, 35 the same, and as those eggs mature with you, they actually undergo that atresia more frequently and more often and more quickly, okay? And then our ovaries actually produce our hormones, okay? So we actually have testosterone just like the guys do, just not nearly as much, okay? And then our main female hormones are estrogen and progesterone. Menopause occurs when the ovaries stop making enough estrogen in order to produce periods. So I thought I'd throw a little bit of humor in there. So a lot of us focus on hot flashes because hot flashes are probably the thing that drives most of us the most crazy. But unfortunately, menopause affects every part of your body, from the top of your head to the tip of your toes. Okay? So this little picture kind of gives you just a comprehensive overview of all the different kind of side effects that your body goes through with menopause. So let's start at the top. Our brains. Menopause affects our brains. It can cause problems with memory, concentration, anxiety, sex drive, and sleep disturbance. And then your breasts. So the breast can undergo atrophy with menopause, and you can also experience more breast pain with menopause. Your bones. Surprisingly enough, we as women start to lose bone at around 28 years old. And then certainly you can lose bone more intensely with your pregnancies, especially if you're not getting adequate amounts of calcium and vitamin D. So that process starts at 28 and then it kind of skyrockets during and after menopause. Blood vessels. This is where the hot flashes come from, okay? But also a lack of estrogen or a decrease in your hormones can also increase your risk for heart disease. Skin, dryness, and itching, okay? How many people remember that episode of Oprah in the 80s or 90s where they were taking the Premarin vaginal cream and rubbing it on the face to make the face more plump and perky and that sort of thing? So a lack of estrogen also affects your skin and can make your skin drier and more itchy. Not that I'm advocating putting Premarin cream on your face. In the vagina, so a lack of estrogen can definitely cause dryness, painful sex, and it also changes the environment, the pH inside the vagina. And so the vagina lives at what we call an acidic pH, okay? So if you remember studying acids and bases in high school and college, the vagina lives at an acidic pH. And so when the pH environment changes inside the vagina, that can put you at risk for more infections. And then fatty structure, okay? How many times a day do I see patients that say, you know, the scale is not really any different, but my clothes fit different. And I work out, and I exercise, and I eat right, but in the midsection here, I'm noticing these little love handles. And so definitely the fatty structure, your distribution of fat in your body can change just because of your hormones. So how do we help our bodies to make these changes? The very first thing that I'm going to emphasize with you as your physician is overall health and nutrition. That's always the first line of defense for anything throughout your whole entire life. Get adequate sleep. How many of you out there have said or have met people that have said, I don't need 8 to 10 hours of sleep. I can make it by with 3 or 5 hours and then I'm good. Wrong. We all as adults need 8 to 10 hours of sleep. The studies are out there. People that don't get adequate amounts of sleep have more depression, more anxiety, more illnesses. So people that are well rested actually have a better fighting chance against the common cold, flu, pneumonia, all of those things. Lower your salt intake. So there's this little thing that they teach us in medical school, wherever salt goes, water follows. Okay, so how many people have been to a crawfish boil or a fish fry and then by the time you're driving home you can't really get your rings off? So wherever salt goes, water follows, and water has weight to it, as we all know from our periods, okay? So lower your salt intake. Right now, we're very lucky because a lot of companies, even Morton's, is making a sea salt, and sea salt has a lower sodium content than regular salt. And then also using a lot of fresh herbs and spices in your food can help to kind of give it a lot of flavor without just shaking some salt on it. Watch your carbs. So, you know, a lot of people, cookies and cakes and candies get a bad rap. Those are bad, bad, bad. But then pasta, rice, and potatoes are the healthy carbs. Not so much. So whenever you do eat carbs, whenever you eat your pasta, rice, potatoes, and bread, I want to instill a few little things for you. Number one, opt for the brown version. The wheat bread are healthier than the white version, okay? Try not to eat a lot of carbs late in the day. So I myself, if I feel like, okay, I know I'm going to crave something sweet, then I will opt for something sweet at breakfast time rather than at dinner time, okay? Because you've got all day long to burn to get rid of that, okay? And then eat healthy foods. So opt for non-processed foods, okay? When you do your grocery shopping, I don't know about any of you, but I have no willpower. If it comes home, it's gonna come into my mouth, okay? And so the first line of defense is don't bring it home with you, okay? Stay on the outer perimeter of the grocery store, okay? All of your vegetables and fruits and milk and dairy and meats are on the outer perimeter of the grocery store. All of your processed stuff, all of your Kool-Aids and Gatorades and Aids and peanut butter and processed foods are in the middle of the grocery store. So stay on the outer perimeter. So eat healthy. That's another good line of defense. And then, of course, you can use multivitamins in order to plug those little holes if there's some vitamins or nutrients that you're not getting through your diet alone. De-stress. We all have stress, okay? We all know driving in Baton Rouge is a nightmare, okay? Some of us have more stress than others. But again, I'm an optimist. I feel like a lot of how you function in life has to do with your outlook and your perspective. And so we all have stress, but try to figure out some inventive ways to deal with that stress, okay? If you know that that drive to work is horrendous, then fix yourself a great cup of coffee before you leave the house in the morning, or play your favorite song on the radio. Just figure out something to do that's a healthy way of dealing with that stress. And then move. Stop taking the elevator, take the stairs. If you feel like taking the elevator, drag yourself over to the stairs and take the stairs, okay? Just do that once a day, okay? It doesn't have to be this grandiose change and I'm going to change everything about my life. Just change one thing a day to improve your health, okay? Go shopping. Shopping is a great form of exercise. You have to walk to shop, you have to carry all those clothes with you, and then you have to swipe that credit card a million times. So shopping is a great way to get exercise, okay? And oftentimes I like to call it retail therapy. Having sex. Okay, and don't roll your eyes at me because yes, sex is a great form of exercise. People that have sex within a committed, trusting relationship actually are emotionally and physically more healthy than the rest of us, okay? So believe it or not, you release all sorts of wonderful, feel-good, healthy chemicals in your brain whenever you have sex, whenever you have an orgasm. The same hormones that you release whenever you have a satisfying sexual experience are the same hormones that you release whenever you breastfeed your babies, okay? And so having sex in a committed relationship can be physically and emotionally healthy. Go dancing. Go dancing with your girlfriends. Take Friday night off. Tell the husband to watch the kids, or, you know, tell the husband to clean the house, and it better be really clean when I get back home. And go dancing with the girlfriends. Or, you know, if you want to go dancing in your living room by yourself with your Wii, do that. But just move. So I know that some women have wished for death going through menopause, but there have been no reported cases of death from menopause. And so again, this is just a little reminder that the #1 killer for us as American women is cardiovascular disease, okay? So exercise, eat right, watch your sugar, watch your salt, take really good care of your body. It's the only one you have. So how do we help our bodies to make these changes? So when all else fails and you say, Dr. Thomas, I ate all that green stuff you told me to eat, and I took the stairs, and I'm still miserable. I'm still having hot flashes and night sweats, and it hurts whenever I have sex. Then our next line of defense is going to be to talk about hormones, okay? There was a huge study about 20 or 30 years ago called the World Health Initiative, and they looked at this very thing. They looked at, okay, so when we give hormones, what hormones are we giving? Are we giving estrogen alone or estrogen with progesterone? And what are the side effects, what are the benefits from giving these hormones to women, okay? Because if you dial the clock back 20 or 30 years ago, everybody was on hormones. And then now you barely hear about anybody being on hormones. So what we found out from this huge study is that really hormone replacement should be the least effective dosage for the least amount of time, and then we should taper you off. You really don't need, or you shouldn't be on hormones for 15 or 20 years at a time, okay? Estrogen is where the money's at. You only need to be on a combination of estrogen with progesterone if you have a uterus. So if you've already had a hysterectomy and you don't have a uterus, you don't need that hormone balance with both estrogen and progesterone to protect your uterus, okay? Let's spend a little bit of time talking about bioidenticals, because there's a lot of information out in the media from celebrities talking about bioidenticals. So are bioidenticals really a whole lot safer than traditional hormonal therapy prescriptions that you get from your doctor? And the answer is no, okay? So they do have two kind of branches of bioidenticals. They have the ones that are FDA regulated, but then they also have the compounded drugs that are not FDA regulated. So there are a few compound pharmacies here in town, and compound pharmacies actually do exactly what it sounds like. They compound the hormones to specifically fit you, okay? But these are not FDA regulated, and so when you go into the store and buy any medicine off the counter, the FDA is regulating that medicine to say that pill number 1 has just as much concentration, just as much medicine as pill number 1,000,001. Whereas drugs that are compounded, you can have variations in concentration, okay? And then bioidenticals carry the exact same risks as traditional hormone therapy. So if you have a history of breast cancer or stroke or heart attack, and your primary care doctor says, you really shouldn't be on any kind of hormonal therapy, bioidenticals are no more safer. They carry the exact same risks. And then cost. So traditionally, a lot of insurance companies do not cover the cost of bioidenticals, okay? So you have to be careful about that. And then saliva testing has not been shown to be reliable. So a lot of the compounding pharmacies will use, a saliva specimen and measure the amount of hormone in your saliva in order to grade or determine your response to the hormone. But saliva testing has not been shown to be reproducible. So if you have a history of breast cancer, if you have a history of stroke or heart attack, or if you've had a clot develop in your lungs or in your legs, venous, or VTE is the doctor word that we use, and your primary care physician or your breast surgeon has said you cannot be on hormones ever, 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 then what are some other ways that you can help your body deal with these changes of menopause? So believe it or not, your alpha and beta blockers, traditionally we've used these medications for a long time just for blood pressure therapy. But now we know that alpha blockers, typically clonidine, and beta blockers, any of your LOL drugs, metoprolol, atenolol, if you've ever heard of those, can be used to help you with hot flashes and night sweats. They're not going to be as effective as hormones, but it's better than nothing. And then vaginal lubricants. So if I have a patient that comes in and says, Dr. Thomas, I'm really not having a whole lot of issues with hot flashes or night sweats, but sex is really, really painful, then I'm going to say, okay, well, let's try just a regular over-the-counter vaginal lubricant, no hormones. You can go to the grocery store and pick that up, and that can be sort of a help in terms of helping you with painful sex. The main thing with lubricants is you want to make sure that it's a good quality lubricant, okay? So I know we can all bargain shop, but this is something you really want to invest in, a good lubricant. So you want something that's water-based or that's silicone-based. You do not want an alcohol-based lubricant. Can anybody figure out why? Because if you're already having painful sex and the vagina's tearing with intercourse and you put alcohol in there, that's not going to be pretty. And then, ospemifene or osphena. Osphena actually is a drug that's FDA indicated for painful sex. A little bit more complicated. There is a hormonal issue with ospemifene, so that should be discussed with your doctor before starting on that one, and it requires a prescription. And then bisphosphonates. So one of the other things that came out of that huge study with about hormones is that we really don't want to put you on hormones to protect your bones from bone loss. That's what bisphosphonates are for. And then antidepressants. So Paxil is the only non-hormonal FDA indicated drug for the treatment of hot flashes and night sweats, okay? Sleep aids like Ambien and Lunesta. So the same sleep aids that you use all during the rest of your life can be used after menopause in order to help with insomnia. And then here goes our little clonidine again. So the same little clonidine, the same little pill that you can take to help with your blood pressure, to help with your hot flashes, can also help with sleep. So clonidine has this nice little side effect that at about 30 or 45 minutes after you take it, it makes you really, really sleepy, okay? If you have any problems with your blood pressure already and you're already taking a blood pressure medication, that definitely needs to be discussed with your primary care physician before we start you on that one. So I put this slide up here just to remind us everything that shines is not gold, okay? So some things to kind of use with caution, buyer beware: acupuncture, reflexology, phytoestrogens, so like soy products and things like that, and then red clover, and then your herbals, black gohash, ginseng, St. John's wort. All of those have been touted a lot to help with menopause, but when we as physicians, we in the medical community, or as nurse practitioners, or healthcare providers, make recommendations to the public, make recommendations to you about things that you should do for your health, generally we rely on studies. We take a group of individuals and we see what medications work and don't work. And so to this date, no studies have shown that any of these therapies are effective at treating menopausal symptoms. More humor. I haven't had sex in so long, I think my virginity is coming back. So what about sex? So who in here thinks that they know what the two major factors are interfering with sex are for us as women? Anything? Just throw it out there. I'm sorry? Pain, okay, all right. Dryness, okay. Those are all some good answers. Surprise! The two major factors affecting us after menopause: lack of a partner and sexual dysfunction in the partner. That's why you see Viagra commercials all over the TV, okay? So what are some of the patient-specific, what are some of the things that are affecting us as women in terms of sexual function, okay? Sexual desire is number one, okay? So either less desire than what you previously had or a complete desire. Don't look at me, don't touch me, just get away from me. Arousal, so either less lubrication or a complete lack of lubrication. Orgasmic dysfunction. There are actually two kinds of orgasmic dysfunction. There's primary. Dr. Thomas, I've never in my life had an orgasm. Never, ever, 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 never. And then secondary dysfunction. That's, I had great orgasms and then menopause hit and it's like, I can hear the crickets chirping, okay? Painful sex, and this kind of encompasses everything, okay? So how many people in here enjoy paying taxes? Yay! Time to give the federal government more of my hard-earned money. So of course, if there's pain involved with something, you're not gonna be like, yay, let's have sex. You're just going to kind of grin and bear it and try to make it through. So what are some other problems? What are some other kind of global issues that can affect sexual function after menopause? Heart disease is a big one. And this goes back to that first slide that I showed you about health and nutrition. So, you know, all the little things that happen throughout your life leading up to menopause, you know, salt and alcohol and carbohydrates and sugars and all those things can affect your overall health. And so believe it or not, you know, the way that we function as human beings, both men and women, in order to get sexually aroused, you have this massive onslaught of blood flow. So to the genital organs. So if you've got vascular disease, if you've got blood vessel disease, then you're going to impair that process and you're going to have trouble with sexual function, okay? And then a lot of the blood pressure medications that we use to treat high blood pressure and heart disease can affect your sex drive as well, your ability to get aroused and your desire. Diabetes is a big one. Diabetes is a horrible, awful, awful, terrible disease, but the good news is that it's almost completely preventable. Watch your sugar, watch your salt, move. Depression, okay? So depression and the medicines that we use to treat depression are a major factor in sexual function. In fact, the #1 factor affecting sexual desire disorder is the use of antidepressant medications. There are a few antidepressants out there that do not affect your libido and your sex drive, but the vast majority of antidepressants do. Okay, and so if you're having problems in that area and you're on an antidepressant, you certainly want to discuss that with your physician. Neurologic disease, so things like multiple sclerosis and Parkinson's, those are nerve disorders. And so if you're, you know, having problems with sensation and that sort of thing, that can certainly affect your sexual function. Body image. So we live in a country where, you know, we expect 50-year-olds to look like 20-year-olds and 60-year-olds to look like 40-year-olds. And so there's a lot of pressure in that in terms of body image and staying, you know, staying young and looking young and that sort of thing. So that can definitely affect your desirability or your sexual drive. Changing family roles. How many times a day do I hear from patients, I don't feel like a wife anymore. I feel like a caretaker. I feel like a roommate and a nurse and a caretaker, and that is not very sexually desirable. So these changing family roles as, you know, as we age and mature and that sort of thing can certainly affect sexual function. So what are some of the normal physiologic changes that occur for us with menopause? #1, slower lubrication, okay? And this is just a normal change. It is going to take more time to get lubricated within, after menopause. And then a reduction in vaginal size. So I wanted to bring this out because a lot of people think it's just a lubrication issue, but it's not, okay? The vagina, that's why I put that other slide on there about feeling like a virgin again, okay? The vagina actually shrinks after menopause, okay? It actually gets shorter and less stretchy, okay? How many of us remember those jeans from the 70s that you'd starch them up really good and then you like pull them on and then you lay back on the bed to try to button them up? So, and then now jeans have that good stretchy stuff in them, so they slide right on and you button them up and they're nice and comfortable and they move with you. So that's kind of like how I like to think about the vagina. So the vagina used to have the good stretchy stuff, and then after menopause, not so much, okay? So that's why you can have more tearing, more pain with intercourse. So it's not just a lubrication issue, it's also a stretchy issue, and if you're having those kinds of problems, then you probably can't get away with just using a lubricant. You probably need some local estrogen therapy. So the #1 way to fix this issue is local vaginal topical estrogen, okay? So even in some instances where your breast cancer doctor or your primary care physician will tell you no hormones, no way, there is very little systemic body-wide absorption of estrogen when it's locally applied to just the vagina for a very short period of time. So if you're having a lot of problems that are causing a lot of distress in this area, discuss it with your breast doctor, discuss it with your primary care physician and say, hey, look, if I've got to live like this, I just don't want to live at all, then that's something that you can kind of discuss with your doctors, and then maybe, we can come to some kind of understanding that you can use just some local vaginal estrogen for a short period of time on a limited basis. And then slower arousal. So it's going to take more time to get there, okay? And that's just a normal change with menopause. So, in conclusion, above all, stay healthy, okay? So your health, your good health is your first line of defense when it comes to anything, and certainly menopause. Hormones in moderation. So we don't want to use hormones to help prevent bone loss or anything else. We only want to use hormones at the least effective dosage for the least amount of time, and only for the treatment of hot flashes and night sweats, okay? So a lot of times I'll get patients that come in and they say, I'm having some hot flashes and some night sweats. And so my first question to them is, are these symptoms often enough and severe enough that you would want to take medicine every single day? And if your answer is no, then bye-bye, see you next year. Call me if you need me, okay? Speak up. So I last gave this talk in 2015, and unfortunately there's not been a lot of advancements in terms of medications and therapies for us as women. But the one positive change I think that has occurred is that we are speaking up more, and women expect to have good sexual function even after menopause. And so, this is not a topic for a 5-minute annual exam. If you're having trouble in terms of hot flashes and night sweats, and certainly in terms of sexual function, that's not a 5-minute discussion. That is something that you're going to have to schedule another visit with your physician and say, this is a problem for me, I want to kind of delve into this. And if you either A, don't feel comfortable, or maybe your physician is a little bit nervous about talking about this with you, ask for a referral to an actual psychologist or even a sex therapist, somebody that can really delve into this and help you and improve your quality of life. And then it could be worse. You could be going through puberty. All right. Thank you all for your attention.